Hi, this is Mary Carrick of Frontrunners Innovate magazine, and I am with Marissa Fayer. And Marissa is an innovator in women's health, and I love the way that she approaches what she's doing. We're going to talk about that in a few minutes, but I really want Marissa to talk about where she came from to get to the place of the health space, and then women's health, and to talk about her work and where she's going to go with that, the impact that she's having with it. So, Marissa, welcome. Thank you for being with me, and let's talk about you for a little bit. So tell us where is the background that supports you getting into this line of work?
Well, I mean, it's engineering. I mean, quite honestly, I wanted to be an astronaut, so I didn't even know about healthcare except, you go to the doctor kind of thing. So I had no idea. And then I wanted to be an astronaut. I was going to university, and one of my professors said, "Oh, if you're not loving this, why don't you just change disciplines in engineering?" So I did, and it was great. And as I was graduating, I was recruited out into a healthcare company. And, I've always been curious. I always want to help people. And that was always why I, wanted to be an astronaut. I was really interested in a lot of things. And so I just wanted to keep learning and growing, and then I can help people. And I think with healthcare, quite honestly, when you get in it, you never leave, because you wind up loving it. And so I stayed in healthcare. Still in it my entire career, 20 years later. And so I started as an engineer. I was helping develop new products, helping, optimize products as we went forward. And I changed companies several times. And I started working with a healthcare company whose big focus was women's health. And I was on the development team for the 3D mammography system. I was one of the few people who helped it get through like the first one, into manufacturing and out the door. So it was really exciting. And I just kept on growing within that company and, going to management and moving around the world, moving into Latin America for several years as well. And so that was my healthcare journey. I mean, I kind of didn't know anything else. And it was really interesting to me. I felt like I was always helping in some way. I'm not a doctor, I'm not a nurse. But these are the people that need innovative, really interesting products. And so I just fell into it. It was not purposeful. I mean, I'm a woman in STEM, so I was always really passionate about that. And so I think just it led me into the passion for women's health. And thank goodness that I was working for a women's health company, and I was able to see that was my passion going forward. Mm-hmm. So I think blessed and lucky to be in the right place at the right time.
You can see the passion coming from you. I love that. We've been kind of talking off and on for a while, so I knew that you had that bend, and that you were kind of structuring and restructuring what you've been doing. And I love the fact that what you're really aiming to do is to bring needed supplies and equipment for women's health to areas of the world that are in real need for that. So tell me the genesis, foundation or nonprofit, and then to sort of a social enterprise business, what you're doing now. So give us that story.
As all good stories it starts at a bar in Costa Rica. So,
but started at the bars.
Everything starts at the bar before COVID, but this was way before. And so I really saw the gap between the equipment that has been returned from our fancy schmancy hospitals here in the Western world, and that in the US and in Europe that, were returned every 2 years, or returned for a scratch, or returned for something like that. And when I was living in Costa Rica, I thought, well, why don't we give back to the community that we're working in? And so I was told about this whole region that was, had really high rates of breast cancer. This was just after I developed the 3D mammography system, and I knew that there was tons of returns of equipment coming back because people wanted to upgrade. And I just thought it was, quite honestly, stupid to not repurpose that equipment. And a lot of times it is repurposed, but there's always pieces of equipment that are just thrown in the trash. And I've had to do it myself, which is heartbreaking. And so started it there within the company. And then, years later, I left corporate. It was back in the back of my head, like, oh, do this, start this. And then finally, I started HERHealthEQ and several years ago. And it's really building off that tenet. There's a lot of excess equipment that is sent back. and is oftentimes repurposed and sold, but there's still like this gap of piece of equipment sitting in a warehouse and it's already been written out of inventory, and eventually people just want to clear out space. Or, you know, developing countries don't care if there's a scratch. It gets to them with a scratch anyway, so it doesn't matter. And they're just grateful for the technology. And so started as a nonprofit because quite honestly, I didn't know any better. And I thought that was the way you do it. I'm not a nonprofit person. I'm a for-profit person. And I quite honestly just didn't know any better. So started it that way. And I wanted to kind of prove out the model and work on some programs and small things, kind of bootstrapping and just very quietly. And then we started to gain a lot of momentum, and really the model works, and, you know, got larger partnerships and things like that. And so just also was always gnawing at me that I was going to have to spend the rest of my life asking people for money, which is not something I'm comfortable doing all the time. And I just thought I'd rather spend my time and the organization's time doing the work and helping women, as opposed to continuously fundraising. And so we switched into a social enterprise, which is still a nonprofit, and we're just able to be revenue generating, which is great because then we can self-sustain, and we can still fundraise, and we're still going to go after grants, and we're still going after corporate partners, because those things are all needed no matter what. Regardless if you're a social enterprise or you're self-sustaining, there's always a need, and it just helps us expand larger. And, you know, I decided to focus on women because they're the cornerstone of society. And no offense to the men. I mean, sorry, they're not. But, you know, especially in a developing country, women are the cornerstone. They're the ones enabling their kids to go to school. They're the ones providing for their families. They're the ones that are, you know, really giving the structure. And everyone's working just as hard as everybody else. Yeah. And my whole thing was, I want girls to go to school. And I figured out that girls aren't going to school because their mothers and their aunts and their grandmothers were sick. Yeah. And so the girls are pulled out first. And given that I was in healthcare, I figured, let me solve what I can solve. And that's kind of where why we decided to focus on women. And there's no reason that women or anybody in developing countries shouldn't have access to quality medical care. That's where we are.
So tell me, I'm kind of curious from the standpoint of how you get the actual movement of the equipment to, you know, another country. Tell me how that works out. I mean, I hear so many stories about how difficult that is. But I mean, is that something that you guys do, or do you arrange for that with whatever partners that you have?
So it depends. Sometimes in small doses, especially for pilot programs, like I might be carrying it, you know, in a suitcase. So hopefully no border agents are hearing me, but no, with letters from the ministries and everything. So, but most of the time we work with our partners. Our partners have a lot of developed, infrastructure systems that they move equipment around the world. And so the thing about HERHealthEQ is we partner with a lot of organizations, a lot of companies, because we don't want to replicate what's already out there. We're not putting our teams in the field because there's tons of organizations that already have great established teams that are already in the field. We don't want to create a brand new distribution system because quite honestly, there's tons of companies, UPS, FedEx, DHL, all of those, and also, you know, that are well established, but also a lot of, other companies that have infrastructure in place to do that. So we work to partner with them as well. And there's also a lot of medical device manufacturers that have these development systems and transport systems already arranged. And sometimes the equipment's in country too. So if there's pieces of equipment that are in country, it always makes it so much easier for us to move it somewhere else or move it to a different type of program.
Right. So tell me a little bit about the partners that you have. If you can share names, that's fine. But if not, just give us an idea of how you partner with people. I mean, how would somebody seeing this partner with you if they wanted to?
Yeah, so we have a few different types of partners. The first ones are medical device manufacturers that obviously we want to have their repurposed equipment and deploy it into the developing countries focused on women. So we've partnered with Boston Scientific, we've partnered with SAOTE, with LUTAC, with Medgyne, with YSAP, several different companies. So the first one's medical device manufacturers. The second one are potentially either or companies or large NGOs like Japigo or Cure Cervical Cancer. Those are our partners because they're our operational and implementation partners, because they're the ones that have teams physically on the ground that need our equipment. And so we get them the equipment, and then we work, they do all the screening and testing. And then we have just other, we have also corporate partners who are really interested in supporting programs like this. And that's either through funding or through some other strategic alliances, like a shipping partner, or it could be oftentimes we're working on partnerships with banks or with corporations or consulting firms, other CPG products, things like that. It fits very much into their women focused, their health focused, developing world focused. We do a lot of work, all of our work is developing country, which lends itself to be very diversified and also with diversity and inclusion. Our tagline is equipment for equity. We're literally working for equality. So you can't have equality without equity. So what we do helps have an equitable and equal world. And so, it fits into a lot of those, those boxes, which is great because, listen, there's tons of companies who have a lot of money. They don't need to set up their own systems. They need to support the organizations that are doing the work. Yeah. And those are a lot of the partners that we're always looking for. And listen, we're always happy to have, private people and anybody support our programs and serve as a resource or an advisor or a connector, of course, like you. And so listen, I love to just talk to people and hear, their passion as well and see if they can help. And if it's not something that fits in with them, then, I know enough people in the industry that maybe I could connect them to something else as well.
Well, we're all about health and wellness and technology with Frontrunners League and Frontrunners Innovate magazine. And, you and I have talked about projects coming and going. We've got one in Africa right now that I think would be tailor-made for, having a conversation down the road. They're not quite ready yet, but when they are, we're gonna hook you up. But as far as partners goes, I think, we can definitely, my wheels are always running. So we could definitely kind of move some people in front of you. And for those of you listening, I don't know many organizations that are doing such a good thing from a standpoint of being a social enterprise with women's health. I know there's lots of NGOs and that sort of thing, but to come along and have this sort of innovative approach to almost like a recycling or a greening sort of thing. So getting that equipment that maybe would be sitting in a landfill somewhere into the right hands and being so purposeful and impactful, that's just amazing. So we applaud you. Thank you, Marissa, very much.
No, and it very much goes into exactly what you said. 70% of donated medical equipment winds up in a landfill because it's not purpose-driven. It's just thrown into a bucket and, thrown into a container. We're doing it very specifically, and we want to make sure that things are working for a significant amount of time. Right. We want to make sure that they're directed as well. And so we don't want to be part of that. We want to take equipment out of a landfill.
Yeah. And support who you're giving it to so that they know how to use it and that they stay in your loop. So Absolutely. I love that. That's fantastic. So, we're going to be supportive of you. And those of you listening, please support Marissa and her work. We're going to drop in the link to your website on the YouTube video and also on the page that we have this embedded. So thank you. You're helping to make the women's health and maternal health edition of this magazine just really special. So thank you, Marissa, for all your work. And we're going to be following you. So we'll be back in touch with you again to check up and see how you're doing. All right,
thank you so much.
You're welcome.